Well, we're here at Blue Cross Blue Shield. We're talking about a lot of wonderful things that you can do with this company, and one of them is the individual plans. Brent Carter is with us, manager of the individual plans for Blue Cross Blue Shield. Brent, this has always been such a confusing market, the individual plan versus, excuse me, the group plans. And it seems since the Affordable Care Act or Obamacare, whichever you want to call it, the individual plans all of a sudden are in the forefront. Let's talk about that. What is an individual plan?
Okay. The individual plan is a family, it can be a family plan that you don't acquire through your employer.
Right.
So you go directly to the insurance company and enroll in an individual plan.
Right.
Or with the inception of the Affordable Care Act last year, and they created an exchange, then you can go to the exchange. You know, Blue Cross and Blue Shield of Alabama would still be your carrier if you selected one of our plans, but the actual enrollment piece went through the exchange. So this is our second year. Okay. Last year, the initial enrollment period for the Affordable Care Act was October 1st through March 31st, so a 6-month window.
Right.
This year, that enrollment period is November 15th through February 15th. So we have a much shorter window.
Okay, okay. November the 15th, 2014 to February 15th, 2015 is the enrollment period for the individual. And that's important because of what?
Okay, the folks that enrolled last year, it gives them an opportunity if they want to change plans.
Right.
It would open up an election period so they could choose another plan.
Right.
They can continue and keep what they currently have.
Right.
And anyone that didn't enroll last year, this gives them the opportunity to enroll in a plan.
So if they're working for a company, it doesn't matter if there's 5 employees or 500 employees, does the employer and that individual says, I don't want to be on the group plan anymore, I want to be on the individual plan.
Right.
Can they do that? Do you know? Is it up to the employer? How does that work?
There are certain rules governing the employer plans.
Right.
And if an individual has access to affordable coverage through their employer, then they wouldn't be eligible for the individual market.
Right.
So it's really designed for those folks that don't have access to coverage through their employer.
If they work for someone and they don't have coverage, the individual plans are where they should go.
Yes.
Right. And they can do that through the exchange, or they can do that directly with Blue Cross on the website.
Yes.
Either way, they can go.
And they can call us. They could actually call us. They can visit our website.
And can you tell them whether they are eligible for a subsidy?
Absolutely.
You can tell them that on the phone.
Yes.
Or on the website.
We can give them an estimate
Right.
based on the number of members in their household,
Right.
based on their income.
Right.
We can tell them you're likely eligible or you're not eligible or not likely eligible.
Okay.
We work with the exchange and we would refer them to the exchange because the exchange makes that final determination on whether you will receive any subsidy or tax credit for your
Okay, so if you are in a group plan and an affordable group plan with your group, you stay there. If your employer does not offer, you have the exchanges, or you can go directly to the company, to Blue Cross.
Correct.
Now, let's say there's a bunch of people that were covered till they were 26, right? That's a bunch of folks. And on their parents' insurance plan, no matter who it is. But they turn 26 with not in the enrollment period. What happens? They turn 27 rather, not in the enrollment period. What happens to them?
Then that would be considered a qualifying event, and that 26-year-old would be given the opportunity to enroll in a plan.
Anytime during the year.
Anytime during the year.
So they don't have to. So if February 15th is the deadline and they turn 27 in May, they can still enroll in the individual plan.
And there's a list of qualifying events that would allow you to enroll throughout the year, such as birth, marriage, divorce. You move into Alabama from another state.
Okay.
So and that's just a few of the examples.
I want to talk just for a second about the network, because the network when I look at the network at Blue Cross Blue Shield, you know, I got to keep my doctor, I got to keep my hospital, because they were all in the network.
Well, that's one of the biggest deciding factors, and fortunately we have a very strong network of providers.
Yeah.
But when you're shopping for a plan, that would be one of the areas that I look at the most.
Yeah.
Is my physician covered under the plan?
Right.
And really play a big part in the decision of which plan should I choose.
Just to summarize, okay, there's an open enrollment from November the 15th to February the 15th for individual plans.
That's correct.
That's correct. Okay, we got that right. Now, there's no evidence of insurability, right? Everybody qualifies.
There's no pre-existing conditions.
No pre-existing conditions.
There's no underwriting based on your health conditions. It is the Affordable Care Act,
right,
as far as regulations and guidelines.
Okay.
So yes, you can enroll during that period.
Doesn't matter what kind of health condition you're in, you can enroll.
You can enroll.
Okay. So right now we've got individual plans and group plans, and that's how I hope we explain to you how the individual plans work. Please go to the website. It's right on the screen. It should be about right here. The website will be on the screen and the phone number. Give them a call and get the information you need, because this is the time for individual plans, and a lot of folks out there need them.